Today, I'm sharing the stage with Jessa, the woman I love and with whom I've been married for 13 years.
I am too excited to share the stage with the man I love, with Eddie, because today we want to share the story on how love and commitment brought us together and powered the connection of public health and civil infrastructure. This mindset of love and commitment helped us lead an exciting initiative in Puerto Rico, and we believe that this mindset, we could scale it nationally and help renew our public health system and civil infrastructure for all in the United States.
When we started our careers, here in Pittsburgh, by the way, we never thought of aligning our two fields together. Jessa is a public health professional. She designs programs to make people healthier. I am a structural engineer by training. I design, as far as my career, earthquake-resistant infrastructure. I admire her so much that I've always wanted to bring our fields together, but the opportunity never came in. But January 6th of 2020, something happened. Something that will test our love, will test our commitment to each other, and will bring our fields together.
At about 4 a.m. that day, an earthquake struck Puerto Rico. Eddie, as a civil engineer, he mobilized tens of his colleagues from the United States and Puerto Rico. We were in Houston, by the way. Mobilized them with him to Puerto Rico to inspect homes. Eddie shared his intent on Facebook, and it went viral within minutes. The need was evident.
At that point, I realized this is no longer a typical structural inspection with a group of structural engineers. We realized we needed the help of a public health professional because this was a disaster recovery and a public health intervention. So we needed the help from someone like Jessa to help us mobilize to people in need in the middle of chaos and trauma.
So here's where I come in. As a public health professional, most of our interventions are based in the social ecological framework. This framework shows that an individual is influenced by the relationships they have, the institutions that they have access to, the communities that they live in, and the policies that are impacting that region. We needed an intervention that can pull all of those levels to help the people in Puerto Rico. So we did just that. But before creating anything, we needed to hear the stories. We were in Houston. We didn't know what was really happening. So we put together a form to ask that question. What is happening in your home? What is your experience? Help us prioritize your case, or an engineer can come and make an inspection. We collected over 15,000 stories where we quickly realized this was not just about the inspections. People needed to be hugged. They needed to be heard. They needed to be connected to other health and social needs. So we created a program that did just that. We created a program based on their experiences where they were able to tell their stories and they were able to be heard and connect them with the different resources that they needed to then connect them with an inspection where they could be there in their home, talk to the engineer, understand from their perspective what was happening, and connect them with the resources they needed. Next thing we knew, we had over 100 volunteers from the public health, construction, civil engineering fields helping the communities. But they were all focused with a love and commitment to making sure that the needs of those individuals were met.
But something happened. Things got more complicated. As you recall, the earthquake happened in January of 2020. And we all know here in this room what happened in March of 2020. COVID lockdown. This was very scary for us as structural engineers doing the inspections, because now in Puerto Rico, the government required for people to be locked down in their homes, the homes that were still structurally unstable. The ground was still shaking because of the earthquake aftershocks. It was very scary, but nothing was going to hold us. The love and commitment was just so strong. Immediately, as engineers and public health professionals, we innovated. We developed a platform together with public health professionals where people in their homes will connect virtually through a platform online with a structural licensed engineer. We will inspect their homes. We were committed to them. Through this platform, we reached out more than 1,000 people all across the island. We gave peace of mind because people didn't know if their homes were stable or not. We helped rebuild over 300 homes and helped them through the reconstruction process. We also identified 12 life-threatening situations.
And what life-threatening situations? I remember our case manager, Lucero. She was following up with one of the cases, and she was talking with this lady, and as she was sharing her story, you could hear the pain and the sorrow through the phone. She lost her home during the Hurricane Maria in 2017. She lost her home again because of the earthquake, and now she lost her husband because of COVID. She was devastated. You could also hear the wind and trucks in the background. Our case manager caught that. We asked her to to turn on her camera, and we noticed that she was on a bridge, contemplating taking her life. We quickly acted and included a psychologist in that call, and we were able to intervene right there, right then. We saved her life, we assisted her. I was then starting to see how poor infrastructure was directly connected to the well-being of the people.
Jessa, I also remember very vividly this moment where one of our geotechnical engineers was doing a virtual inspection with this family. And our engineer identified a crack in the ground level, and to the lay person, the crack maybe was not that significant, but our geotechnical engineer warned of a potential landslide in the home. Immediately, that geotechnical engineer called Jessa, her team of public health professionals, mobilized faith groups, mobilized community leaders. It was my first time seeing civil engineering involved in the socio-ecological framework in action. And it was funny to me because the image that you see here is structural engineers engaged with people. We were talking in socio-ecological framework terms. We engineers don't talk like that. We're all about getting the job done as safe as possible and moving to the next problem. But this time was different. We were so immersed in the community. Our love and commitment was so strong that we just worked together with them.
I started seeing civil infrastructure as public health.
And I started to see civil engineering as public health. It was an aha moment for us.
We started seeing the intersection of these two professional fields powered by love and commitment unfolding in front of our eyes. When you start seeing engineers with a health equity approach to reconstruction, you know that something different is happening. In fact, when we had the inspection visits, even if they were on Zoom, we had what we call the 80-20. 80% of the time, we were listening to the people, listening to their experiences, validating their emotions. The other 20% of the time was the actual technical work. Next thing we knew, on the other side, you also had public health professionals talking about civil engineering. Here we have Lucero as a public health professional talking about civil engineering to the community and for kids and how that connects into improving health.
As I reflect on this experience, it has been love and commitment what has held our marriage for 13 years. It hasn't been easy. Tons of challenges we have had. But the same love and commitment powered this group of volunteers in Puerto Rico, regardless of the challenges, regardless of how tough in the middle of a pandemic. The love and commitment was so strong that we decided to act at any cost.
And the cost we had to pay was huge. You see, I always say that there's a reason why underserved communities remain underserved. Because of the hurt and the complexities of the systems that pushed us there, now we need to work in completely different ways that we have never worked before. Now we have to make sure that we're listening to the stories and we're believing their stories and building systems based on those experiences. Now we need to make sure that we're loving and we're committing to help these communities.
This brings us to the vision that we want to leave you today. What we experienced in Puerto Rico at a smaller scale with 100 engineers, we do believe we could scale it at a national level here in the United States to achieve that societal renewal that we need in our civil infrastructure and our public health system. Let's bring public health and civil engineering together. Let's power it with love and compassion for one another. We will see more healthier and more resilient cities.
Here's why love and commitment is so important. As a health professional, I start thinking of models and what are the factors that are making communities remain unhealthy. And you can get buried in so many different complicated factors, and everything is connected. And when you hear their experiences, everything is happening at the same time. It is complicated. But when we focus on just loving and committing to that person and helping them to raise from all of the things that are happening, all of those complexities goes away because you're focused on loving them and building something and bringing them with the, from the hand and taking them out of that system.
History shows us that cities here in the United States, they blossom, they improve public health because civil engineers designed public with a health approach. That was to lift everybody up in a city, in a community, regardless of their background, because the civil engineer was focused on improving the health and well-being of that person. We saw cities across the United States building water infrastructure to give access to all to clean water. We saw urban electrification for all. We saw walkable cities, engineers and architects working together for people to have access to them. This was done in the US. Public health, civil infrastructure, loving our neighbor, scaled throughout cities all across the country. Today, this is applicable. This is the path to societal renewal that is focused on love, building healthier and more resilient communities.
Love and commitment is what's going to help us bring the renewal that we need in this country. It was love and commitment that has kept our marriage together. Believe me, it was not easy to put together a presentation with two completely different perspectives. But love and commitment is what kept us on track. It was also love and commitment, that power, that innovation of all those volunteers to ensure that we can reach the people where they needed it the most.
So, let's bring people together. Let's bring people to build healthier infrastructures with a public health and loving focus. Jessa and I, we did it in Puerto Rico at a small scale with about 100 engineers. Imagine the possibilities if in this country we do it with thousands of public health professionals and civil engineers at a massive scale.
So let's do it. Let's power that societal renewal by pouring love and commitment to renew our public health system and civil infrastructure. Societal renewal is at hand.
Thank you.
Thank you.